Now, that's still at 17 days old.
This boy is now 5.5 years old and has a normal heart. Lower left sternal border.
Yeah, you have to push.
Our next patient represents a 42-year follow-up of an innocent murmur which was recorded on a phonocardiogram. He is now 67 years of age and has the same innocent murmur. Lower left sternal border.
Again, early to mid. He was head of our hematology at Georgetown, and we had interned together. And when I was making recordings of different things we could hear, I used him as a subject. And I have this phonocardiogram that was done many years ago, but indeed that was innocent, as you can see. But you can make that diagnosis and be absolutely correct on it. You don't need all the other tests. Now let's go to this next patient. Is an all-pro football player, and when he's lying on his back, there's a wide split of the first sound. There's and then there's an innocent murmur, and then over the left sternal border, the first sound is split, the second sound is split, and the innocent murmur is there, and that's when you think, could that be atrial septal defect? And if it stayed fixed like that, which it was lying flat, well, that's one of the first clues of atrial septal defect. It can be just like an innocent murmur, but it's the wide splitting that identifies that. So then you just merely stand them up, and with that, then the second sound gets single with expiration, widens, as we've heard with the others, with inspiration. Now we will give you a couple examples of this, but this was quite a football player, and there have been some good Redskins, as you know.
And not uncommon in athletes. It is important to differentiate these from significant murmurs, such as those with aortic stenosis, hypertrophic cardiomyopathy, Marfan syndrome, and so forth, which could and have resulted in sudden death. We will now listen to two National Football League professional football players. Our first was all-pro, healthy, and had innocent murmurs. His heart rate is slow, typical of conditioned athletes. Lower left sternal border.
You have to press. Now, if you just listened quickly and specifically, like to instruments, you would note that first sound you can hear is split, not is not single, or even close to split. People say at times, my patient has a wide split of that first sound. And so what does that mean? It may mean nothing. It's we all have splits. If I come around the room and listen for a split sound, it'll vary whether it's very closely or wider like this. And if you were the big football player, I'd expect to find it wider than maybe on another person. Then once you get that, drop it. And then listen to the second sound. That too is split. And drop that quickly. And then again, concentrate on the systolic murmur. And that's where with the pressure that you would quickly identify that early to mid, and we're going to get this.